Do you want to learn how to remove or relieve muscle knots or contractures? Then stay tuned to this video that you'll like it. Hi guys, welcome back to Fisiolution, your physiotherapy, health and wellness channel. In today's video we want to talk about muscle pain and how we can relieve or remove what we commonly know as contractures or muscle knots. Before we start, we want to talk a little bit about how these contractures or muscle knots are produced or what they consist of. Basically, a muscle consists of fibers that are intertwined and have the ability to contract, i.e. to approach or relax, i.e. to stretch. However, there are times when some of these fibers are dysfunctional and remain constantly contracted. This produces what is known as a contracture or muscular knot, which is what causes pain. And how do these contractures that we have just explained originate, or how do they occur? It has many origins, right? Most of the times they are produced by bad postures, by muscular weakness. Even many times they are also focused on changes of stress or anxiety in the person. And what symptoms do we feel when we have these contractures? What can we feel? Very easy. Normally we have punctual pain in a concrete point. For example, my neck hurts in this concrete point here. Normally you indicate it to us with a fingertip, which is called fingertip pain. Also, when the pain becomes a little more chronic or a little more complicated, the muscular area contracts a little more and the pain can radiate to other parts of the body. That is to say, not only to have fingertip pain in a specific area, but that this pain radiates, for example, in the trapezius area, towards the neck, towards the head. Sometimes we can even have irradiation towards the shoulder and down the arm. Well, before we start teaching you the 4 simple steps to relieve all these contractures, these muscle knots, we always indicate that you put heat, such as with a bag of seeds of these, 15 or 20 minutes in the area to be treated so that the muscles are warm, already have enough oxygenation and blood, and then when doing the exercises we can do them better. Okay guys, let's go with the first of the exercises. What we want to teach you is to do a kind of self-massage of the painful area, okay? As you can see, I've already drawn the pain area or the muscle that we're going to treat and the pain point, which is where we have the mark here. Okay? Even if the pain point is in a specific point, as we said before, at the tip of the finger, we have to try to treat the whole muscle area, because otherwise the treatment would not be 100% effective. Okay? What we are going to do is, as the muscle basically goes from this area to the neck and down again from here, we are going to start from the top down. Okay? With our hand on the same side, we're going to grab the area and with some pressure, without hurting us, but it has to hurt a little bit, with some pressure, we are going to go down from the head area down the neck. Through the neck to the shoulder. Once we reach the shoulder, we can knead with the whole hand. That is to say, we take the whole muscle with the hand in this way and we go from the back to the front, sliding with the skin of the shoulder. Forward, sliding with the skin, with some pressure, without hurting us too much. We go advancing towards the shoulder, and we can spend 3 to 5 minutes making the passes. Okay? Once we have massaged the whole muscle, we can focus a little bit more on the point of pain. As we have mentioned, the point of pain would be here. What we can do is to press with the arm that you are most comfortable with. Okay? With this arm, as I can't quite reach it, I'm going to do it with the other arm. We would squeeze the point. And we can do several things or squeeze the point for a while, more or less. 60-90 seconds until we notice that the intensity of the pain decreases. Or we can also put pressure on the point and make mobilizations of the muscle. That is, moving the head. We keep the pressure and we do, for example, lateral flexions, flexion extensions, or rotations of the head in this way. We tighten. And we make mobilizations of the muscle to one side, to the other, upward, downward to squeezing and extension. And then also we can spend more or less 1 minute, 60 seconds doing the push-ups as we have said. Okay guys, let's go with the second technique or second exercise. Is the same as we have explained in the previous exercise, but this time we can do it with a ball. We use this especially for those points where we find it a little bit uncomfortable or we can't reach with our hand. Okay? In the same way we can do with the hair. We take with the palm of the hand, place it on the muscle that is causing us the pain, and we can make sliding By all the zone, piknak, we can go doing certain pressure without bothering in excess, but that it is there. That it is there moderately uncomfortable, okay? After the 3 or 4 minutes or 5 minutes that we can be massaging the whole length of the muscle, we can focus on the specific point. We put the little ball on the point of pain. We put pressure and we do, as we mentioned before, the head mobilizations, okay? We can do the rotations slowly to change the length of the muscle. The lateroflexions to one side and to the other, or the bending stresses, which would be downward and upward. All this, as we have mentioned, as long as we do the specific point, approximately 90 seconds, until we see that the intensity of the pain is decreasing. Okay guys, let's go to the third one. For the massage to be really effective and everything we have done to relax the musculature, we will have to stretch it, okay? So that what we have achieved is prolonged over time. To stretch it, in our case, as it is the area of the neck of the trapezius, it is very easy. To stretch it, what we are going to do is the hand of the side that we want to stretch, we are going to take it to the opposite hip. In this way, we lower the shoulder a little bit and increase the tension in the muscle, okay? With the opposite hand, we're going to grab our little ear and we're going to pull without doing too much force towards the opposite side. And we are going to look towards the arm that we have elevated. Here at this point, you should already feel tension from practically the area of the head to the shoulder. At this point, when you feel the tension, we hold more or less 30-40 seconds and perform the stretch a minimum of 2 times. Once in this mode, we can also play a little bit with the rotation of the head to focus the stretching in the area of the shoulder. To focus the stretch on the different portions or the different fibers of the trapezius, okay? Until we notice the point where we feel the most tension, there at that point we stay, and after those 40 seconds, we would relax. And remember guys, on the subject of stretching, it is important that they are long, that they are minimum 20 seconds, 30 seconds, please. Otherwise, the exercises are not going to be effective. Well guys, let's finish with the fourth and last exercise. After everything we've done, we're going to try to strengthen the musculature. As we said, muscle weakness is one of the most important factors in neck pain, right? To strengthen the musculature, we are going to show you some exercises called isometric. What does isometric mean? That is, it is a muscle activation, a contraction of the muscle without movement, okay? To do the neck isometrics, we are going to perform 2 gestures, lateral flexion and rotation. To do the gestures, we are going to prevent the movement with our hand. That is to say, if we are going to do this rotation gesture, we are going to put our hand on the side of our forehead and we are going to try to look to our right side, preventing the gesture with our hand. We will hold between 5 and 10 seconds the isometric, and after those 5 or 10 seconds, we will relax. We would relax, we would have to do approximately 2 or 3 series of about 15 seconds of repetitions. And let's go to the second movement, which would be the lateral flexion, okay? Then we are going to do the same thing. We would place the hand on the forehead, on the lateral part of the forehead, and we will try to do the gesture. Let's go over there, bring the ear towards the shoulder and block it with our hand, okay? We make the gesture with some force, without hurting ourselves. We hold it for the few seconds that we have mentioned. And then we would relax. As we have said, 2 or 3 series of more or less 15 seconds, okay? If you have been left with a bad taste in your mouth and want to learn a little more about how to effectively perform more strengthening exercises for the neck muscles, we leave in the description of the video some links to other videos we have made previously, in which we explain a little more specifically how to perform these exercises. Well guys, before we finish, we have focused on the muscles of the neck, but this would be valid for any muscle in the body, as if it is a leg, a calf, an arm, or any other area of the body, okay? Performing these guidelines that we have given you, these 4 exercises, any type of muscle pain, no matter what area it is, you will surely alleviate it or get rid of it completely. Well guys, so much for this week's video. I hope you liked it. If so, leave me comments, give me the like, subscribe, also to the little bell to be aware of the best content of physiotherapy, health and wellness, and to healing and beyond. Until the next video, bye.